much. A few words about the International Journal of Care Coordination. If you have very detailed or very specific questions, I always tell, please reach out to Jenny. Jenny has much more experience within SAGE than I have. So Jenny is the senior editor manager. She does not just has the International Journal of Care Coordination, but also I think she has about 10 or 15 journals to deal with. So she has a lot of experience in terms of, you know, very practical things when it comes to tables or figures and so on. Obviously, we have just like the other journals, I suppose we have a very international editorial board, people from Europe, South America, US, Japan, but as you can see, most people from Europe. I think that is because how it all started. The International Journal of Care Coordination has been around for a little while, but using different titles. So it was launched as the Journal of Managed Care, moved on being the Journal of Integrated Care. I don't know for what reason, but they left that title. Then took the Journal of Integrated Care Pathways title, and since 2014, having me on board, they actually asked me if I wanted to carry on that title, and I chose for this title, the International Journal of Care Coordination. So I think that situates us a bit differently from the two other journals. I think as we are primarily interested in the interaction between people with a health condition, or patients and their caregivers, as well as healthcare professionals. So the micro level is probably the area where we pick up most of our manuscripts or articles. So you can see the title of care, the definition of care coordination as provided here. I always tell people, you know, to check this paper by Ellen and Catherine, which was in the inaugural issue, at least when I started working as an editor for the International Journal of Care Coordination. Because if it doesn't fit within this title, which is a pretty broad definition though, I usually tell people that they have to look for another journal, because this is what the scope of the journal is all about. So there's one advice already for you: always check the aim and the scope of the journal. If it doesn't fit, then it's very hard to get it in. We publish 4 times a year, so every quarter. We are a member of the Committee on Publication Ethics, COPE, and recommend authors to follow the recommendations formulated by the International Committee of Medical Journal Editors, which I think is very useful for you to check if you are not just writing the paper by yourself, but if you're working with a team, you need to make sure that you set the right set of arrangements among the authors. Both the Committee on Publication Ethics as well as the Committee of Medical Journal Editors, I think, provide you with a lot of guidelines in that sense. There are no fees payable to submit or publish. We only, as all other journals, I suppose, we only accept original work that is not being considered for publication elsewhere. We accept different types of papers, original articles, systematic reviews, meta-analysis, study designs, leaders, tailpieces. What we do is, since we are focusing on this micro level, we request authors of original articles and systematic reviews to insert, well, at least, I was going to say, a separate paragraph about the relevance of study findings from a patient perspective. These are just a few stats. So the acceptance rate is about 1/3. The average time to publication is around 75 days. And the full text downloads, well, 2016 was an exceptional year because then SAGE offered people free access. So there are some arrangements between different countries and universities and SAGE. I believe, for example, the Dutch universities, they have free access to upload full papers, but that doesn't account for all countries or all universities. So 2017, 2018, we had around 8,000 full text downloads. Making an impact, yes, we are enlisted in different databases, ranging from the British Nursing Index database all the way down to Scopus. I think these days, if you want to make an impact, not just focus too much on the traditional databases, but also take into account Altmetric. So since you're all tweeting, maybe not, Altmetric, I mean, it's not just that your work gets picked up when it's published in a journal. It's also because you make use of social media and people find your article actually because it's referred in social media. And that is what the Altmetrics actually measures. We also work with Kudos. Kudos is actually, it's a free service which helps you also to make that impact, making use of Twitter, LinkedIn, and other social media platforms. And actually, I think these days, you know, if you don't want to limit yourself to the scientific audience, but also want to reach out to healthcare professionals, patients, community, etc., really think about how to sell your work by yourself, and Kudos actually provides you a very nice platform for this. There's an upcoming joint call for papers. So together with the Healthcare Management Forum, we are jointly producing a one-of-a-kind themed edition on transforming healthcare. So you're very much invited to submit your work. We're looking at the final quarter of this year. There will be a more information soon on websites of both journals. That's it. So please, once again, if you have very specific questions, you can send them to me, but usually I ask Jenny, so then maybe ask Jenny right away. Thank you so much.